Let's talk about scapular movements. There are 6 scapular movements. When we assess shoulder, we need to assess these movements as well. Elevation, depression, upward rotation, downward rotation, protraction, retraction. First of all, we'll talk about elevation and depression of scapula. Upward movement of scapula or shoulder blade is called elevation, and downward movement of the scapula is called depression. The muscles involved in elevation of scapula are upper trapezius and levator scapulae, and the muscle involved in the depression of scapula includes serratus inferior and pec minor muscle. Now, let's talk about protraction and retraction. Movement of scapular blade or scapula away from the spine is called protraction, and movement of scapula towards the spine is called retraction. The muscles involved in protraction are serratus inferior and pec major and pec minor muscle. The muscle involved in retraction are rhomboids major, minor, and medial trapezius. Now, let's talk about upward rotation and downward rotation of scapula. Upward rotation is also called lateral rotation, and downward rotation is also called medial rotation. Let's talk about upward rotation. When inferior angle of scapula moves outward and upward so that the glenoid fossa move upward, this is called upward rotation. When inferior angle moves medially and glenoid fossa moves downward, this is called downward rotation of scapula, which is also called medial rotation because the inferior angle of scapula moves medial towards the spine.